Good afternoon, and thanks for joining us. It's 2 o'clock and time to start today's briefing. Joining us today, we have Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, Marlena Jackson, Interim Commissioner of the Milwaukee Health Department, and Dr. Dan Waxman, Vice President of Transfusion Medicine and Senior Medical Officer at Versity. County Executive Crowley, you're up first.
Thank you so much, Sydney, and I hope everybody had a happy and safe Thanksgiving and weekend. I just want to say thank you to everybody for making the hard choice to stay home and stay safe. I know that this holiday was not easy for many of us, and I hope you found ways to really enjoy time with your family and in small groups, virtually or by phone. And so if you did spend some time in a group, please consider quarantining yourself for the next 2 weeks to help contain the spread of COVID-19. We aren't out of the woods yet, and there are a lot more days left in the year and more holidays to celebrate that are coming up. And so I want to encourage everyone to make sure that they have a plan to stay safe while still staying connected to the people that you love on a consistent basis. So please know that at Milwaukee County that we are doing everything that we can to make the healthy choice the easy choice. And so we want to continue to evaluate, particularly here at Milwaukee County, how we can continue to keep county residents healthy. And so we're making a few changes to the COVID-19 health screening policies for Milwaukee County employees and contractors. So effective today, version 3 of the administrative order on COVID-19 health screening policies is going to update our procedures for screening employees and our contractors as well. So it's going to introduce some requirements for screening visitors to indoor county facilities, as well as the screening of individuals in the care or custody of Milwaukee County. So what does this new administrative order do specifically? Well, it's going to clarify that public safety officers that are stationed at every public entry at the Milwaukee County Courthouse Complex, the Vale Phillips Justice Center, and the Zufari will be responsible for screening employees and contractors entering at those particular locations. This order also introduced signage and visitor screening requirements at indoor facilities operated by Milwaukee County, and it confirms the general requirements for screening of individuals who are in the county's care or within our custody. So with these enhancements, it is our hope that Milwaukee County employees, our contractors, and our visitors will stay safe and healthy and be able to do the important work that they do in this community every day. And so with that, I'd like to hand it over to Mayor Barrett.
Well, thank you very much, Mr. County Executive. I think we're all aware that Dr. Fauci and others were talking about a spike in cases following Thanksgiving, and we certainly hope that that does not happen, but we'll see. And I want to join the county executive in thanking those individuals and those families who really changed their normal methods of operating on Thanksgiving by having smaller groups. I think that was a wise move. And now we'll see in the next couple of weeks whether that was something that most people followed or whether we see a spike. I will say that the testing for yesterday was actually lower than what we have seen over the last couple of weeks, which is just fine. At the testing at Miller Park, we had 1,527 people. On the Northwest side, we had actually a very healthy day with 604 people. And on the South Side Health Center, we had 343. So we still had 2,400 people tested yesterday, a very solid number of people being tested. But I think as people understand the guidance, and I think the commissioner may go into this as to when the proper time to be tested following your belief that you've been exposed to someone who might carry the virus with them. With the cold weather coming upon us, here we are December 1st, so we're going to have a change in all sorts of parking regulations. But another change that goes into effect today, in essence, is that starting today, the Milwaukee Continuum of Care will provide shelter for individuals in need during the winter months. This is obviously a very dangerous time of the year for people to go out as we started getting into the very, very cold weather. But due to COVID-19, the warming rooms will operate differently this year than they have in the past. In accordance with our local ordinances and CDC guidelines, the Continuum of Care will make its best effort to shelter all those currently experiencing homelessness or fleeing domestic violence in shelters or socially distanced non-congregate settings. At these shelters, community case managers will help support these individuals with their plans to obtain housing. So again, we want to have the safe haven for individuals, particularly when the weather gets cold, but we also are going to have the community case managers because our goal is to make sure that people can get more permanent housing. That's what the goal is. And this has been a great partnership that we've had with Milwaukee County as well. The continuum of care will also work closely with Milwaukee area shelter partners to provide COVID-19 support and assistance through our health department. The health department has been very engaged in this and will continue to do that. For individuals who are in immediate need of housing services, I would say the best place for them to start would be by calling 211 because that's our coordinated entry system. That's where we work with different providers. So 211 would be the place, again, as the weather gets colder. I know it's getting a little chillier today. We're going to have a couple of warmer days, but it's December, it's Milwaukee. We know what's coming. Another thing that's coming, or it's actually arrived now, is a step up in our order violations enforcement. What we have decided to do as a city is to increase the fines for those businesses that are violating our orders. Milwaukee Health Department orders have been a key part of our community's effort to reduce the spread of COVID-19. Masks, social distancing, limits on group gatherings, that's the kind of thing the order specifies. It's all very, very clear and clean as to what we're trying to do. And we've been on this message for almost 9 months now. So people obviously should know by now, businesses should know by now. But when it comes to bars, restaurants, catered events, and other large gatherings, we heard anecdotally that some business operators were willing to accept a $500 fine rather than comply with the public health orders, which is exactly the route we didn't want them to go. So, well, as a result, the penalty is going up. An ordinance was passed through the Common Council and won unanimous approval, then it will increase the penalties for violating the order from a maximum of $500 to a maximum of $5,000 per violation. Now, what we've seen in the past is when we have our inspectors go in, oftentimes there's more than one violation. It might be one for masks, it might be one for not following social distancing, it might be one for limits on groups gathering. So that $500 fine could have jumped up to $2,000, just as the $5,000 fine could jump up to as high as $20,000. Again, it's not our goal to fine businesses. That's not what we're trying to do here. Our goal is to make certain that everyone in Milwaukee is following the public health orders. And I say that knowing and hoping and praying that these vaccinations that we're reading about and seeing on TV are going to allow us to break through and have what we hope will be a normal summer, maybe even normal springtime. But we know that the FDA is looking at a number of emergency requests to have these vaccinations approved and distributed. So for the first time, literally in months, I think that we can have a little sense of optimism in the coming months that we'll be able to have these vaccinations. That is all the more reason to comply with our orders, to make sure that we do not overwhelm our hospitals, that we do not overwhelm our funeral homes around the holidays with people who are thinking, okay, we're out of this, we're out of this, we're out of this, because the fact remains we're not out of this. We might see potentially a light at the end of the tunnel, but for now, this is when I think we really have to hunker down so that we can get through this and get life back to normal. So